Welcome to the Personality Couch podcast, where we discuss all things personality. I'm your host, Doc Bach, here with my co-host, Doc Fish. We are both licensed clinical psychologists in private practice, and today we are continuing our series on obsessive compulsive personality. Characterized as being rigid, robotic, and icy, this checklist-loving type buries their emotions and desires in the name of following a contrived social script. So let's unpack the conflict underlying this type that leads to such rigid behaviors.
Let's start by defining some terms first. So very simply, obsessions involve thinking and chronically being in your head, whereas compulsions involve doing, so constantly acting and being busy. Now, someone with OCPD is going to be a rigid thinker, a rigid doer, or a rigid thinker and doer at the same time. So they operate in a very machine-like, mechanical way, often showing flatness and no emotions. They're human doers versus human beings. And to be at this disorder level, it has to be extremely problematic, interfering with life and relationships.
And it's actually hard to determine what is pathological and what isn't in regard to obsessive and compulsive dynamics, because our Western society idealizes productivity and reinforces workaholism, especially in the States. So workaholics and type A personalities are actually super helpful in our culture, especially in a capitalistic society, because they do the hard work, making money, staying up till midnight, working on that project. They'll do whatever it takes to get the job done, no matter the personal cost. And of course, greedy CEOs love it and benefit from it. So these behavioral patterns are even desirable in many workplaces.
Very much so. So then OCPD becomes disordered only when the thinking and doing is the main motivation driving the bus, and when the rigidity overtakes helpful life functions.
Yes, yep. So these types are robotic. They follow a strict script and seem to operate on a life train track, and they can never deviate from it. And with that, they often miss the forest for the trees. So at disorder levels, their productivity is really just unproductive, mindless action, as if someone has made like 1,000 sticky notes about how to do the thing, but then misses the deadline to actually do the thing. So the rigidity is paralyzing and actually runs counter to their actual goals.
Now, it is important to note that obsessive and compulsive can clinically be separate, but they do often coexist in the same person. So an obsessive personality is going to be thinking oriented, like maybe a philosophy professor who maybe thinks in logics all day long, but doesn't actually like do or act.
Okay. Yeah. So the obsessive types ruminate and mull things over and over and over again in their mind. So it stays in the mind and in the thoughts only. Meanwhile, a compulsive personality is going to be action oriented, perhaps like an accountant or a carpenter, acting to make sure everything is perfect.
There are a lot of nuances and confusion here. So as symptoms, both obsessions and compulsions can happen in any personality. We often see a strong compulsive component in dysfunctional personalities, but these are symptoms, not like a core personality.
Yes. It's just the outer layer of the gobstopper, but not necessarily what's at the personality core. So a compulsive component is actually very common in many personalities because, again, of how it's reinforced in our society.
Now, in older language, we called obsessive compulsive disorders neuroses, or basically like anxiety focused. Now, these symptoms, right? Symptoms are ego-dystonic, meaning it's outside the person, it's bothersome to the person. But in the obsessive compulsive personality, it's ego-syntonic, meaning it's acceptable, it's internal to the person.
Yes, absolutely. Yeah. So ego-syntonic, meaning it's one with the psyche. So their neurotic, rigid energy is the person. It's not a syndrome that comes and goes depending on the stress. It's persistent and, as I say, baked in to the psychological makeup. So those with OCPD are the embodiment of a frozen, rigid person. They are robotic in their approach to life.
So for an example, the compulsion to step an even number of steps before I have to turn can be annoying and frustrating to me. And that would be ego-dystonic. But my tendency to write and rewrite my 10 million lists and sticky notes are perfectly acceptable to me, and that would make it ego-syntonic.
Yeah. So even though rewriting sticky notes does not at all involve task completion, it's still fine. Just following the script. This is all well and good and even culturally appropriate at times. But what makes it actually dysfunctional? So I'm going to pass that question to you, Doc Fish. What is going on internally that makes this so problematic?
Yeah, internally, there is a foundational emotional conflict involving the fear of being punished or condemned versus rage, actually, at being controlled.
Ooh, even if they're the ones doing the controlling?
Absolutely, because it's a power conflict. And get this, it stems from potty training.
Oh my word. Why do most personality disorders always seem to involve crap in some regard?
Right? I think maybe it's like the mess inside of our humanness. I don't know. But it takes us to Freud, who did have a fair theory about developmental stages in children. So he noted around the age 1 to 3 for kiddos, they move from putting everything in their mouths to focusing on potty training. And then he expanded this physical related stage to understanding the psychology and individual temperament involved in the potty training process.
So do children who become obsessive compulsive personalities have problems with potty training? And does that mean something about their developing psyche?
Why, yes, and yes. But first, I do want to preface this discussion with the unfortunate fact that Freud was not always in his right mind due to his cocaine addiction. But also, he did have some decent hypotheses that we can redeem in our understanding of psychology today. And the anal character is one of those things that we have redeemed.
Sure.
So Freud's understanding of being stuck in or having a fixation at the anal development stage involves unconscious difficulties around handling aggressive urges. Specifically, Freud found 3 main things. So the first thing is that both potty training and OCPD are wrought with issues such as being clean, stubborn, and punctual, as well as a tendency towards withholding.
Ooh, yes. And also interesting, he found what he called anal imagery, or basically like pottying verbiage in the speech, dreams, fantasies, and memories of those with OCPD. If you think that's bizarre, Nancy McWilliams also said the same thing. So she said, I have found this too. The earliest memory of one obsessive man I treated was of sitting on the toilet refusing to produce. And when I invited him to free associate, he described himself as tightening up and keeping everything inside. This is Nancy McWilliams. So there's something here. Yeah. So those with OCPD usually have a history of their parents trying to potty train too early, too harshly, or just in an over-involved manner. But what is it about potty training that is such a big deal here that impacts personality?
Well, potty training is actually the first time that we have to hide natural processes like peeing and pooping in order to be socially acceptable. Before that, babies are totally free to do whatever they want, and it's adorable, right? Like a 3-month-old's pooping face is so cute, and it's perfectly fine and humorous that a little baby pees on you, right? Yeah. But a 2-year-old's pooping face means that we are rushing to the potty and we're trying to keep it in until we can release it acceptably. So technically, in potty training, there is a power struggle that the child will ultimately lose.
Yes, what an interesting concept. Yeah, and then if the parent is controlling, judgmental, and holds high scheduled expectations, the kiddo can easily develop aggressive fantasies about pooping. But those aggressive urges are usually compartmentalized into a bad, messy, shameful, sadistic part of the self. So the part that holds guilt, shame, anxiety, fear, and anger. So then to handle that bad part, they control, they clean, and they reason to maintain identity and self-esteem.
I think I want to put a little fun historical nugget in here quick.
Okay.
So in 1925, Ferenczi used the term sphincter morality to describe the harsh, all-or-nothing superego that resulted in having rigid ethics.
This is so fascinating. Sphincter morality. Okay.
Right?
So
Right?
more than one person was seeing the potty stuff here.
Mm-hmm. Right.
Wow.
It sounds weird. It really does sound weird to connect pottying to like personality, but there's a connection.
There are.
Okay.
Wow.
Okay. So the all or nothing mirrors the attempt to suppress all the bad parts of the self, creating a conflict between good and bad in the self, in others, the ego, everywhere.
Aha, the conflict. So this is one of the central components of the obsessive compulsive personality because this type is in constant conflict with themselves and the conflict doesn't really ever resolve. So Dr. Theodore Milan called this a constant state of entrapment. So while those with OCPD often do find their place in society that reinforces their workaholism, like a military officer, law enforcement, being a priest, being an overbearing parent, these types do subconsciously resent their roles.
And while they subconsciously resent it, they do strive to become as perfect as they can in their roles, which is very, very conflictual internally.
Yeah.
Like, do you rely on the self and drop your defenses in doing so? Or do you rely on others and then tighten up your defenses, becoming more rigid and resentful?
Yeah. So Milan noted that they face an internal struggle in which the more they adapt, the more they feel anger and resentment. Now, Ratto called this a struggle between defiance and compliance. So their compliance with rules and standards of the outside world leads to more anger. But to look inward and work on the purpose that their rigid behavior serves means giving up control and getting in touch with the undesirable things that maybe aren't socially acceptable. So they would have to give up the compulsive behavior altogether. And that's the very thing that makes them function and not function. It's both.
Yes, they are stuck. And I've seen this distress and conflict actually come out in the body because they are suppressing emotions and they're over controlling their thoughts. And then what's left is that their body showcases the conflict.
Of course.
So I've actually seen a lot of autoimmune disorders with OCPD, like psychoanalytically, it's the body attacking itself.
Absolutely. Yeah. And just the trauma of suppression too. Wow. So the physical symptoms then showcase that inner conflict, and physical discomfort or medical concerns are often what lead them to seek treatment in the first place. So interestingly, those with OCPD actually have a strong desire to be independent and assertive, which is actually similar to the antisocial personality in that way. But they are so far removed from these core desires and drives because they sequester them. They bury them. They lock them up via excess control, constriction, and restraint to keep any of those unsociable characteristics from popping up.
Milan actually said, quote, "The restraint, however, is merely a cloak with which they deceive both themselves and others. It serves also as a straitjacket to control intense resentment and anger."
Oh, I love that visual. That is exactly what is happening. Yeah. So they look super compliant on the outside, but on the inside is a buried rebellious spirit. So the obsessive compulsive cloak serves to get rid of or bury any bad, rageful, or antisocial urges. So with that, they often use the equal and opposite to cope, becoming self-righteous, legalistic, and hyper-moral.
Yes, this is called reaction formation, and that leads us to their defense mechanisms.
Okay, here we go.
So let's start with reaction formation. Reaction formation as a defense involves replacing like bad unconscious desires with opposite desires that are acceptable and thus conscious. It helps defend against uncertainty, and there's fixation on both ends of the conflict.
Yeah. So a classic example would be of a preacher turned activist who is 100% against LGBT rights, but is secretly having a relationship with another man.
Or a more adaptive example is a surgeon with conscious desires to help, but has underlying unconscious fantasies of harm.
Oh, that's an interesting example. Yeah. So the yucky stuff inside gets converted into something socially acceptable.
Yeah, and the perfectionism, conscientiousness, and dutifulness of the obsessive compulsive person is the reaction to hiding their unconscious desires to be messy, irresponsible, and rebellious.
So reaction formation is a very common defense mechanism, especially in obsessive compulsive types. But there are others, like cognitive and behavioral defenses that involve isolation of affect, or in less extreme forms, just separation of emotion.
Yes. Okay. So for the obsessive compulsive person, emotions aren't really acceptable because they're viewed as weak and dirty and messy and out of control and childish, right? All the bad things. Emotions are viewed as dangerous and in need of being controlled. So emotions are placed in a box and set aside, called isolation of affect, so that they are inaccessible, suppressed, rationalized, and moralized. So like ask them about their feelings and they will tell you what they were thinking. They use their words to cover up the emotion, not to express emotions.
Okay.
And this like allergy to feelings may even be a form of dissociation if they are so intensely separated from it.
How interesting. Yeah. So there are two exceptions to this aversion of affect, though. So the first is righteous anger. So righteous anger is acceptable to them. Normal anger, not so much. Has to be a reason behind it.
Right. Others can feel their reactive anger, but it's denied. However, they won't deny behaviors that are passive aggressive, like disrupting, interrupting, or pouting. And then the second exception is shame, because it can usually be explored consciously, probably in a way because they're failing to meet their own high standards.
Right. So this is a cognitive shame, like I can't meet expectations, versus actually getting in touch with the stuff they're avoiding on the inside.
Exactly, yes. And this makes them really great in unemotional formal roles like work, but not very good at relational and intimate roles.
Oh dear.
So they do have the capacity to attach and love, but they can't show any tenderness without anxiety and shame. I actually think this is so interesting. McWilliams provided an example that demonstrates that cognitive, logical focus. When asking a male client about the sexual health of his relationships, he reportedly stated, "I get the job done."
My gosh. Do they put that on their online dating profile too?
Maybe a bumper sticker. I don't know.
That's awful. Yes. But it's like for the obsessive compulsive person, like it's a job. It's not a relationship. Like there's a rejection of intimacy, which actually, as I say that, it reminds me a little bit of antisocial personality. So specifically the difficulty showing tenderness. But for the obsessive compulsive personality, tender emotions are inaccessible versus in the antisocial, they're actually rejected in the pursuit of power.
Right. The obsessive compulsive person isn't motivated to pursue power, just maintain their own control. So obsessive compulsives tend to be neurotic, but any personality can function anywhere on the psychotic to neurotic spectrum.
Yeah.
Interestingly, in the borderline to psychotic ranges, obsessional people can actually look schizoid because they use isolation of affect so hard.
Ooh.
And I don't think I can say it any better than McWilliams, so I'm going to quote her again here. She said, "The prevalent misconception of the schizoid person as unfeeling may be based on observations of regressed obsessional people who have become wooden and robotic. So deep is the gulf between their cognition and emotion."
Yes. Wow. Go McWilliams. Yeah. So those with OCPD are robotic. And Milan even calls them cheerless and austere. So feelings are dangerous and must be kept in check and tightly controlled. But different from schizoids, those with OCPD actually lack imagination and creativity because their fantasies are rejected. Like, they're not safe. You can only choose the things on the track, right? On the spreadsheet, on the list. Versus schizoids often enjoy a rich fantasy world inside their turtle shell.
Right. And there's also a very thin line between extreme obsessiveness and delusion. And sometimes obsessive personalities can have paranoia.
Yeah.
I thought this was super fascinating. So again, in McWilliams, she wrote about how we historically perhaps could differentiate OCPD that wasn't psychotic but extremely rigid versus a paranoid schizophrenic that lacked defenses. And this was to put them in a protected room and let them know that they're safe. The schizophrenic would start talking about paranoid delusions. The OCPD would start cleaning the room.
Oh,
which leads us to behaviors.
Oh my goodness. Did they actually do this? Was this kind of a joke or?
I think she's joking, but I don't actually know.
That's interesting. It highlights the different kind of motives is what it's highlighting regardless.
Yes.
Yeah. So behaviors. The behavioral defenses involved in the compulsive person involves undoing. So undoing is literally trying to undo things to unconsciously protect or atone for something bad.
Yeah. So compulsivity is repetition. Impulsivity is acting without thought. And then compulsivity is also not acting out. Like, they're not trying to recreate past experiences to master them.
Yeah. So some compulsive behaviors are helpful. Not all are pathological. So it's not the harmfulness of the action necessarily, but the drive underneath. So you can be compulsively helpful or funny, but other examples include maybe finishing your plate even when you're not hungry, or productive procrastination, like cleaning instead of studying, and technically gambling, like, oh, just another try.
Yeah, usually those with compulsivity show up to therapy because of some other need. And then more pathologically, there can be an unconscious desire of undoing criminality or something involving shame or guilt.
Ooh.
Cleaning your plate, not just when you're not hungry, but cleaning your plate to handle guilt because you know that others in the world are starving.
Ooh.
Or hand washing to clean your hands of aggressive urges, which a good example of this might be in Lady Macbeth, but she also engaged in the action. So it's not a perfect example.
Oh, wow. Yeah. Yeah. So compulsivity also infers unconscious desires of omnipotent control. And in this way, once again, those with OCPD are a little bit similar to antisocials in this way, but antisocials are aware of their desire for that control.
Yes, but OCPD has different internal processes.
Oh, yeah.
So imagine, right? Like, if your thoughts and desires are so bad or dangerous and equal to the action, then you're going to attempt to constrain them with counteractions. So for example, to handle anxiety related to the future, a pregnant woman might repack and pack and repack and pack for the hospital. Or a sports player may engage in a ritual before every single game to cope with anxiety about performance.
Yeah.
But what thoughts are underlying these compulsive behaviors?
Oh, of course. There's always thoughts underlying behavior. Yeah. So Eckelberry listed some core thoughts that the obsessive compulsive personality might live by, consciously or unconsciously, such as being good equals being safe, or an unsafe future can be managed by being in control.
Right. Okay. So striving for perfection and goodness is something controllable that can elicit safety. Well, the perception of safety.
Yes, of course. Yeah. And then other thoughts include, like, one can never be too organized, which I might agree with that one, but what does that say about me? Anyway, another one is rules are meant to be followed by all.
Exactly. You got to keep that control and color in the lines at all times.
At all times. Yep. Follow the train track. Can't deviate from the train track. But more thoughts include, like, my way is the right way, or tension is just part of being responsible.
So their control and rigidity lead here, but it's irrational, right? Like, my way cannot always be the correct way, sometimes, but not always. And then I can also be responsible without feeling tension.
Exactly. Yeah. These are not necessarily things you would want to find inside a fortune cookie, right?
Oh, that's funny.
But these thoughts also sound like they would be a good candidate for cognitive behavioral therapy or CBT to kind of work on the root of those thoughts if individuals with OCPD would come to therapy to work on those things in the first place. We could go there. We could work on those things.
We could. But speaking of therapy, let's talk about our professional experiences with this condition.
Yeah.
So for me, I often see pieces of compulsivity, but I'm not sure I've ever actually seen a true core OCPD case.
Yeah.
OCPD doesn't come to outpatient treatment often, perhaps unless they're coming for a related issue like relational difficulties. But then the focus of treatment tends to stay on the problem and not the underlying personality dynamics.
Exactly. Yeah, because their compulsivity often serves to hide the true stuff. So they won't go there in treatment unless they absolutely have to. But I agree with you in that I have seen many cases with a compulsive component to their personality, but I have never seen true OCPD at the core coming to outpatient treatment. But in my experience, many dysfunctional personalities often seem to have a compulsive piece that both serves to hide the actual dysfunction at the core and to function in society, usually in the form of excelling at work. So already the shell serves conflicting purposes. So then that conflict starts to manifest in relationship breakdowns, leading them to treatment. And I've actually come to call this a compulsive shell in clinical treatment. And I would say probably half of the adult testing cases that I've worked with have had a strong compulsive piece or compulsive shell to their overall personality profile. But again, not necessarily true OCPD at the core, but other personality things along with some OCPD flavors that can lead to some problematic outcomes and a problematic personality structure.
Right. I think that's a perfect way to describe it. It's not the core personality, but it does function as a protective compulsive shell. And the compulsive shell is used to constrain themselves and their pathology regardless of the core.
Yeah.
I've commonly seen a compulsive shell in avoidant personalities where their anxieties are so intense that they tend to act in ways that compartmentalize emotion, and then they focus on completing something within their control.
Ooh.
I've also seen it in borderline personalities.
Absolutely.
But what about you?
Absolutely. Yes. I've seen it in higher functioning borderline patients too, who hold on so tightly to rules and expectations, etc., to disguise the fact that on the inside, they're not okay and they're actually quite fragile. And I've also seen it too with many different personalities when the compulsive shell starts to break down because of repeated trauma or just repeated stressors, or they can't hold that shell any longer. And it's like, if you've ever had the magic shell on top of ice cream, just a little bit of a spoon in that, and it starts to crack. And that's kind of the visual that I have of that compulsive shell can start to break down because it's just a shell. It's encasing all the other stuff underneath, and underneath is usually quite fragile and maybe even prone to melting if we're going fully into the kind of frozen, halfway frozen and melting stages. I've also seen it with paranoid personalities. So this type takes you on a wild goose chase to get to know them because they're so fearful. They have annihilation anxiety. So their compulsivity can often serve as a way to blend in and to keep others off their scent. So if you're following all the rules and checking all the boxes, society won't out you as being extremely fearful.
Yeah. So basically, in all of these examples that we've seen, in line with the true OCPD character, a compulsive shell serves to hide buried dysfunction. But that doesn't mean the compulsivity is the dysfunction.
Yes. Great word. Yeah. So, all right. Today we unpacked a fresh perspective of OCPD according to personality gurus outside the DSM. So we hope you'll tune in for the rest of the series, and don't forget to like, subscribe. It really helps our channel out. And lastly, if you're a personality nerd, we've got blogs, visuals, and references that coincide with each episode at www.personalitycouch.com. Be well, be kind, and we'll see you next time on The Personality Couch. This podcast is for informational purposes only and does not constitute a professional relationship. If you're in need of professional help, please seek out appropriate resources in your area. Information about clinical trends or diagnoses are discussed in broad and universal terms and do not refer to any specific person or case.